want to welcome everyone to the annual public meeting of the Riverland, Mallee, Coorong Local Health Network. For those of you online who may not know me, I'm Wayne Champion. I'm the CEO of the Riverland, Mallee, Coorong Local Health Network. And later on I'll introduce our board chair, Dr. Peter Joyner, and also Craig Lukeman, our Chief Financial Officer, will also say a few words. So I did want to just encourage anyone who's in the room here to put their phones on silent before we start. I know that the Mannum Health Advisory Council would love to take a donation from anyone whose phone rings while we're here. And so I'll just make a start. We're here in Mannum, and so I do want to acknowledge the Nungaruku and Narrawong people as the traditional custodians of the lands and waters that we're meeting on here today. I want to pay respect to their elders past, present and future. And I also want to acknowledge the cultural authority of Aboriginal people from elsewhere that are with us today. And I will just advise people that there is a risk that there are images of Aboriginal people who might no longer be with us in the presentation. Just a heads up for anyone watching. A little bit about the Riverland, Mallee, Coorong Local Health Network. I'm not going to go through all the slides in a lot of detail, but we serve a population of about 70,000 people along the Murray River as it passes through the Riverland and then the Murraylands and then the Coorong, and of course to the east of that to the border, so including the Mallee part of South Australia as well. And obviously we care for and provide services for communities within that catchment. We operate 12 hospitals, 9 aged care services in terms of different forms of residential aged care service, a whole lot of community health services, allied health services and community-based aged care services, and of course some targeted Aboriginal health services as well. We'll just talk very briefly as we get into the business of the meeting. First of all, the minutes of the last annual public meeting were endorsed by the Governing Board of the Riverland, Mallee, Coorong Local Health Network in their board meeting immediately following, or the next board meeting following the annual public meeting. There are copies in the room here for people here in Mannum who want copies, and they're also available on our website for anyone that wishes to access them. If I just go on to the next item. Next item is for our board chair, the chair of our governing board, Dr. Peter Joyner, to give an update from the governing board's perspective. So welcome, Peter.
Thank you. Now, you can hear me. IT. Welcome everyone in the room here. Many people I know, work with, and people I have worked with here at Mannum. In addition to people on Facebook, online, viewing this presentation, thank you for joining. I hope it's not too boring in the sense that it will contain a number of necessary details about what we try to do. There will be slides which people can view, and I will try, rather than reading them word by word, to highlight what I think are significant factors. This is the 4th year of operation. The previous government wanted to have regions having a direct say in how things happened with health services rather than being run from Adelaide. And so there are 6 rural areas. As Wayne has pointed out, we follow the river, pardon me, from top to bottom. The board is chosen on a skill base to bring expertise in health management, finance, Aboriginal health, aged care, commercial management, all those factors to play. And I'm very happy to say that our board, I think, has been very good in having a diversity of talent. And one measure of that is that at our last meeting with the Minister concerning board members, he chose not to replace any of our board members, a distinction which some other metropolitan-based boards don't have. But that's life. So he's happy, and I think the region is being served well, but we will always continually upgrade and modify our board structure to help. We undergo self-evaluations of the board and our committee structure, which includes the necessary finance, clinical governance, aged care and disability governance, and audit and risk. As you can see, I won't speak to it for too long, but clinical governance covers all the medical and health services we deliver, which are critical to get it right. And aged care and disability is in recognition of this as an increasingly important part of our life, with all the Commission's results increasing standards and focus on providing good aged care support, both in residential as well as in home. So, the key achievements we've had, we've obviously just beginning to start another COVID pandemic this week, as far as I gather, but looking back over the last few years, we had obviously the ongoing severe restrictions which were in place. We had vaccination clinics which have now closed. We had the very drive-through screening clinic, which is 2 years. We're also now encompassing surveys on, well, we're both surveying Japanese encephalitis virus in the community, but also engaging in an active vaccine rollout. As people know, it tends to be along the river with a reservoir in some piggeries, etc. And it can be quite a nasty infection for some people, not for every person. We've had the Murray flood. Floods and droughts seem to characterise Australia. The flood affected us at Renmark, where the hospital, without a levee, would have water coming into it and being a problem. And you can't always assume that a levee will work, although it did, but carefully managed with Wayne and the staff of the hospital. We moved out vulnerable people from the threatened possible area, carefully, quietly, professionally, until the flood had gone, and then brought them back home again, and that's worked very well, and we have not had any concern or complaints. It was well handled. We continue the aged care focus, and anyone who looks at any sort of newspaper or whatever over the last couple of years would have picked up on the Commission's hearing pointing out, unfortunately, that across Australia the standards have not been good generally. There's a huge range of standards, and as a result they've now implementing a range of recommendations which are still being thought through in detail. They include how much time does an RN, a registered nurse, spend on the aged care floor, quality of food, care, recreation, a whole range of aspects, which I think is all good, and we as a LHN are committed to improving our standards where we need to make sure we can always offer the best possible standard of care. We've developed an operational plan based on our strategic plan. We've also celebrated the 23 RMCLHN 23 awards, which is for staff. This year we made a specific thrust to try to identify people who are not just top management positions, but people working at all levels on the ground, shall we say, be it in hospital services, cleaning, aged care attendants, whatever you like to think, because these people are those who exercise direct contact with our clients, which is all of our region, and I was happy to present appropriate awards for a range of people who would otherwise not be recognised. We support HACs. We have HAC conference once a year. We're here to hear what Mannum HAC has to say, because we realise that one of our KPIs is to make sure we have an established communication conduit between the community and ourselves to be sure we're doing what the community wants. And HACs are a formal and well-established process for doing that. We have other input from anyone, really, but the HACs we value for their educated input and their knowledge of what we do. We've the various highlights which I would like to comment on are, first of all, our continuing commitment to Aboriginal health and reconciliation. We're supporting, we've got, as people know, at Murray Bridge Hospital, that dramatic Aboriginal art concept outside. We've now got this at Barmer as well. Wishing to extend that further. Paul spoke very eloquently and passionately and pragmatically about the Rural Academy of Clinical Excellence. This, at the moment, trains doctors to be working in the country lifelong, essentially, to serve our region, essentially, because we've identified that in our region we have roughly a shortage of 10 doctors every year. People like myself get too old and retire, and other people. And what's important there is that race is really about a culture. It's the culture of our LHN looking to train its own members in its own way and supporting them. At this stage, it's doctors. We would like eventually to be able to train nurses and allied health personnel, provide them with continual support, an aspirational management structure that they can look to where they will achieve a higher level of competency and managerial and leadership skills which they don't have otherwise, because we can't pay people more money in the public service, but we can certainly offer them a better quality of job satisfaction, and all those aspects are critical to what we do. Paul did mention, but I'll just make the point that we don't accept just any doctor who sends a note in. They're all looked at, screened psychologically, assessed carefully. Are they the right person for us? It's not quite like a marriage broker, but it gets close. We've also had a problem with the sterilisation criteria changes almost every year, and recently it was found that the sterilising components of the Riverland hospitals were not up to the modern standards of next year, and we decided that we'll focus our money and efforts on providing that at the Riverland General Hospital at Berry, and then having a hub and spoke model to take sterilised gear to and from other hospitals as required. And that's underway but not finished yet. Oh, we've got a whole range of plans and strategies. We actually do spend a bit of time at board on strategic future plans, and this is an emphasis. So we reflect on the reconciliation plan. We've launched a disability access and inclusion plan, the diversity inclusion plan, recently the mental health services plan, digital health information, aged care preliminary business plan, strategic asset management plan, and are working towards a Mannum service plan, which I'm sure is all dear to your hearts. So you can see there's an awful lot of work and guidance which we hope will continue the thrust into the future, because we're nothing if we don't focus on the future. These are pictures of assorted people, all representing different areas: vaccination clinic, mental health area, people who've won awards, vaccination clinic and art area. So they're all just people which we'd like to recognise in our organisation. Paul said never waste a crisis. I could also say that when we're presented with a challenge, we prefer to identify it, understand it and answer it, not just react in a rather dismissive way or whatever. This particularly aged care, because it's going to be an increasing focus of standards. We've already at Barmera Nursing Home spent quite a lot of money to totally reorganise how we do things, to try and make sure that's bearing fruit, which is good. And we need to keep on monitoring the new aged care reforms as they're released, so we're up to speed. We've recently undergone accreditation, and in fact it's good news now that we passed the accreditation well. There was a couple of what I call relatively minor points which could be addressed, but the accreditation result was strongly positive, so that's good. Workforce, if you ask anyone in the country, probably across Australia, but certainly South Australia, workforce is the biggest problem. I see they've just achieved a doctor at Woodner, who's an English doctor, who's also got a pilot's licence, and so they've actually been able, because Scott Lewis used to be there, he was a pilot as well, he's at home, and he's just coming there, and they just said how much complexity. It took 2 years of bureaucratic negotiations to get someone to come to there. And that is an example that not every local council can support. It's difficult. So the problem, if you've got our vision is to grow our own, it becomes more of a culture. I was discussing with Paul May today that the culture of race is not just about training, but it's about a culture of blending research of what you're doing, management tools, education, teaching, learning, servicing, linking strongly with primary care, general practice. For instance, when our doctors are in training at a certain time, they spend half their time working in the hospital, for which we pay them directly, clearly, and they spend half their time in a general practice. And the Medicare billings can then come back to the hospital because we employ them. Now, that's negotiated with the Commonwealth, so I won't go into the detail, but it's a way of us trying to support primary care, even though, strictly speaking, we're supposed to be just hospital-based. But we realise our obligation to the community is far greater than that, and primary care, particularly ex-GP, is important. So that's a continued expansion. The RMC Cares is a video conferencing we run out of the Berry Riverland General Hospital, where 24/7, if someone has a problem in a smaller hospital, they can link by telemedicine and try to help and get advice of sorting it out. I've been involved in the early precursor of that elsewhere, but this is excellent, and we would like to feel that what it does then is build the Berry Riverland General Hospital to be one of the few in Australia which actually provides telemedicine education. I used to do some myself, and if you're on a TV linkage to support someone a long way away, you've really got to have a skill base which is quite a bit separate to just your normal one-to-one relationship. And having that as an education centre is pivotal, I feel. We have staff surveys because, again, we are constantly... if you don't look after your staff, you're silly. You need to look after your staff to help them look after you. So surveys and us trying to help in any which way is important. We obviously have recruitment, and we have a staff reward and recognition. I'll be happy now to have a break from me talking, and I'll hand back to Wayne. Switch this off.
Thanks, Peter. I'm just going to give a brief overview of the things that are in our annual report from the last financial year. So it is just a highlight of things that were highlighted in our annual report. I'm going to run through it relatively quickly because some of it is material that Peter's already talked to. And just before I start, it's important to note that our annual report has not yet been tabled in Parliament. We do have copies of it available here in the room in Mannum for anyone that's here to look at, but it's not yet available publicly and won't be until it's tabled in Parliament. We do obviously have permission to share it with the people here in Mannum, and it will be published as soon as it has been tabled in Parliament. So you get the highlights here anyway, regardless. And the last year, 22-23, has been quite challenging in terms of the many different things that the organisation's faced, and has tested our resilience, the resilience of our staff and the resilience of the organisation. It's also been an exciting year of growth with the evolution of the Riverland Academy of Clinical Excellence, us expanding it into a clinical leadership training program, expanding into clinical research, and also providing the medical training that we founded the program on. And it's been, quite an interesting year. If we just go to the next slide. So some of the key achievements. I guess one of the key achievements is that for the most part, we're looking back on having survived a pandemic, but are aware that COVID-19 will always be amongst our community to some degree or not, depending on whether there's a new strain or not. So a lot of the, one of the big achievements of the year has been coping with COVID-19 and then getting to a point where we can stand down some of the specific responses put in place in a state of emergency in response to a global pandemic, and moving back to really business as usual, with the odd variation from that at times when there's a peak in the number of cases or a wave from a new variant coming through. So there's been a gradual easing of restrictions. We've closed and ceased providing LHN-run vaccine clinics, but people can get vaccines from their GP or community pharmacy. They're widely available, whereas when COVID first emerged, of course, there wasn't even a vaccine for it. All of that stuff's happened just in the last couple of years. We've stopped the drive-through COVID testing with PCR tests because rapid antigen tests are available at supermarkets and off the shelf for people that need a test. You don't need to come to a specialised service to test yourself for COVID-19 anymore. So lots of things have changed in that time, really moving us back to very much business as usual, other than the odd time when there's a wave or a ripple in terms of the number of cases. As an LHN, we have been the front line for the state government's response to Japanese encephalitis virus. Japanese encephalitis virus is new to Australia, just only been here for a couple of years in terms of mainland Australia, in terms of our knowledge of its existence in mainland Australia. And so, as an LHN, we've been involved in leading a vaccination program for it, coordinated by SA Health, by the Communicable Diseases Control Branch, really aimed at helping protect vulnerable workers and then people living in and playing along the Murray River who might also be at risk of exposure. And we have also been involved in testing the population in order to try and assess whether or not there's already a degree of exposure and to what extent there's already a degree of exposure to Japanese encephalitis in our population. Peter mentioned the Murray River flood event, so we had really probably the second biggest flow ever recorded in European history down the Murray River. I'm sure there have been bigger flows at other times. At some point in time, you've only got to look at the river floodplain to see that. But certainly a massive flood, superseded only by the 1956 level in terms of European colonisation history of the region. And that, of course, threatened aged care residents in Renmark, and so we had to relocate some aged care residents out of Renmark Hospital into adjacent aged care facilities, and some of them into the main hospital building, which is a higher floor level at Renmark, in order to protect them from the risk of the floodwater should the Renmark Hospital levy fail. Have to say that the Renmark Council did a fantastic job of reinforcing the levy, and in fact almost rebuilt it from scratch while they were aware that the river, the flood waters were moving down the river system towards Renmark. And so fortunately the hospital was safe, and the communities protected by that levy were also safe from the flood. We were also involved heavily in supporting other vulnerable communities, people who live in low-lying ground, people who are isolated due to floodwater, people who might have become homeless due to floodwater, in accessing health services and supporting their well-being and doing welfare checks on them and so on through that whole period, right along the whole length of the Murray River. There are just some photos in the background to, I guess, give a sense of some of the activities around the flood event. Let's go on to the next slide. Some other key milestones, really. We've continued. We were the first local health network in South Australia to have our own LHN Facebook page. Now we're live feeding our annual public meeting across Facebook. So, we've continued to develop in terms of our social media presence, and we're on Instagram, we're on LinkedIn, we've got a YouTube channel, and all of those other things. So lots of work going on in terms of social media. It's a great way to connect with the community in terms of consultation, and it's a great way to get and receive feedback from the community in terms of people commenting on our posts and asking questions from the LHN. Very direct, instant feedback from our communities. We are also using our YouTube channel to live stream and to make available the grand rounds that we run through the Riverland Academy of Clinical Excellence as a way of providing access to clinicians anywhere on the planet, really, and any other people that are interested, communities that are interested, to the latest research globally from key thinkers in healthcare across the globe. So we run these grand rounds as a way of elevating the exposure of our clinicians and our staff and our workforce to different thinking in healthcare, and we make them available to the whole of the world over YouTube for anyone that's interested in looking at them and watching them. So feel free to have a look at some stage. Just some more photos really of some of the various events, everything from the Murray Bridge Soldiers Memorial Hospital Centennial celebrations through to Santa getting vaccinated. Talk very briefly about RACE, the Riverland Academy of Clinical Excellence. It is a brand of the LHN that we use to differentiate the way that we work. It's about really achieving clinical excellence, developing and training clinicians in our own region, getting involved in informing what is best practice in regional settings by engaging in research and literally informing best practice, publishing research, hosting conferences. I've talked about the grand rounds already, and really just changing the way that we work as an organisation. We do have 30 trainee medical officers that we've attracted to the region as part of the RACE clinical training program. As I mentioned before, we also have a clinical leadership program. We're working on developing nurse education programs, and we're already involved in, to some extent, in allied health training programs, but looking to really boost that over the coming few years. Some key initiatives in terms of Aboriginal health. I'll talk about the midwifery model of care soon, but we have integrated the Aboriginal family birthing program into the midwifery model of care. We have conducted yarning circles as a way of engaging with Aboriginal communities across our whole region on a variety of different topics. We run an Aboriginal primary health service in the Riverland, and we have worked to re-engage with the community about the services that it provides. We've established a paediatric clinic in that facility. We've established allied health clinics in that facility, and really are working to make services far more available to our Aboriginal community, where we are the provider of primary health services for them. And of course we work closely with Mirindi Aboriginal Community Controlled Health Service in the southern half of our region, the Murray Bridge and Coorong region, to support Aboriginal clients to access services in that region. We are embarking on some groundbreaking research in terms of prevention and reversal of diabetes, and we're working with Aboriginal people as the investigators in that research, so that we've got Aboriginal people conducting research on Aboriginal health rather than other people conducting research on Aboriginal people. I might just go to the next slide, just some photos. You can see some of the artwork, and we've got quite a lot of Aboriginal artwork throughout the region and are always looking to improve it, and really as a way of signalling that our health services are a culturally safe place that intends to welcome anyone in need of health services, including Aboriginal people, and to connect them to the country and the history of this land. Nursing and midwifery. I've mentioned before the midwifery group practice model. We have now approved the ongoing provision of the group practice model right throughout the entire region. So Murray Bridge, Riverland General Hospital and Loxton Hospital, as our way of providing access to midwifery and birthing support, where a midwife is partnered with a mum throughout the pregnancy journey and supports mum throughout the whole journey, including postnatal care. And really that's changed the way our midwifery service works from the family's perspective and also from the staff's perspective, and it's really boosted our ability to attract and retain midwives because they get a lot of satisfaction about providing continuity of care and about sharing the journey of a developing family with the developing family. Just go on to the next one. Workforce is always an interesting area. We're doing really, really well in terms of medical workforce recruitment. We've improved a lot in terms of allied health recruitment, but have some disciplines that we struggle with, in particular speech pathology. And we are struggling a little with nurse recruitment. And it's a challenging time because the demands for nurses have really changed as a part of the Commonwealth reforms into aged care. So that's set new minimum standards in terms of the number of nurses that any aged care provider must have if they're providing residential aged care services. And that's affected the market in terms of demand for nurses right across Australia. So we have undertaken a second all of staff survey. Just recently the results of that have been shared with our staff and our workforce. And we have also conducted yet another set of annual awards celebrating the many exciting things that our staff have been up to, some of which are showcased here, many of which aren't. And so I encourage people to look at them on our social media feeds as well, if you're interested in seeing what some of the great work going on by individuals and teams right throughout the organisation. We've established our own scholarship program and in fact handed out quite a lot of scholarships, awarded quite a lot of scholarships to staff interested in training really in anything that improves their career and improves our health services. And the two, of course, are closely linked because anything that improves our health services does improve the career of our staff members. And we've developed a wellness webinar series in order to support the well-being of our workforce through what has been quite a challenging and varied year with those things like COVID and Japanese encephalitis and a flood, bearing in mind that staff are directly affected by those same things as they affect the community. A couple of financial achievements. I won't run through them in any great details. I would say that we haven't yet installed the solar panels in Pinner and Lamoureux that are showing on the slide behind me. We have approved the installation of them, but they're not yet installed. We have implemented carbon footprint tracking, so we're starting to pay attention to the impact that we have as a health service provider on the environment. And we have initiated a process aimed at trying to encourage staff members, individual staff members, to develop grassroots, ground-up initiatives at their own health service to improve our environmental performance as well. And they don't have to be about sustainability in terms of carbon reduction. They can be about, a local community garden on the hospital grounds or something like that. And we've certainly shared with staff an invitation for them, any of them that are interested in volunteering or leading something along those lines to do so. And we have developed a master plan for the future redevelopment of Murray Bridge Soldiers Memorial Hospital. And we're also exploring still master planning for Barmera Health Service, in particular with regard to a potential future redevelopment of aged care services there. Of course, it's one thing to do the planning, it's another thing to have the funding. So it's still a journey to go with both of them. And with that, talking about funding, I'll hand over to Craig Lukeman, our Chief Financial Officer.
Thanks, Wayne, and good evening, everyone. I'm Craig Lukeman, the Chief Finance Officer, for those of you who don't know me. Very brief report tonight. We received again this year an unqualified audit report from the Auditor General, so that was obviously satisfactory. As Wayne alluded to, the detailed financials are included in the annual report, and they're slightly embargoed at this stage and can't be distributed publicly, but I'd welcome you to have a look through those. Just some highlights from last year. We were actually favourable to budget in the final analysis of our results, just under $1 million favourable against budget. The department came along very late in the financial year and processed a number of budget adjustments and other adjustments which brought us from about 6 million over to about just under $1 million favourable, so that was a good result. Total expenditure was up in 22-23 on the previous year, 218.6 million. Net assets 111.3 million. And probably the point I'd make tonight, and Wayne's touched on this and Paul's touched on this, and Peter's touched on this, is the challenges that we've got in our workforce going forward, particularly in nursing in this current year. Very high usage of agency nurses, and it doesn't look like tapering off anytime soon. So that's obviously going to present us with a fairly large financial challenge over the course of this year. So with that, I'll just ask if there's any questions, and if not, we'll pass back to Wayne. Thank you.
And look, I'll do the same really, just ask if there are any questions from anyone, either in the room or online. Yep.
Mental health. What sort of challenges do we have lying ahead of us in that area?
So mental health challenges. I think, so we've just got a question from the room, and I'm repeating it because people might not be able to hear because I've got the microphone, you don't. Just asking what some of the mental health challenges are that we foresee that we'll face going into the future. You'll be aware that we've just recently released our mental health strategy, and of course I saw you at the Preventing Suicide, the Suicide Council dinner in the Riverland earlier in the year. Mental health is a tricky area. There are lots of different providers involved in order to provide lots of different choices for different people with, different levels of distress and with different levels of mental health need and with different illnesses. And so getting an integrated approach to mental health services in a way that provides lots of choice to consumers about where and how they seek support is always going to be tricky. We have for a long time had a challenge in that our information systems within health are disjointed. So we in regional local health networks have not had access to the single statewide electronic medical record, for example. We're actually in the process of addressing that. Our region will end up on the Sunrise electronic medical record that the Metro local health networks are on about halfway through the next calendar year. And that project's already underway. With that, there'll be a better understanding of some of the care already provided, diagnoses already undertaken, previous inpatient stays and other health networks and hospitals that a patient might have had when they present to one of our emergency departments in distress, but we won't still have the same view for someone that might be receiving counselling with an NGO provider, for example. So that it's both an opportunity in terms of consumers being able to feel safe to access care where they need it without thinking that anyone's got a view of it necessarily if they're going to an NGO provider, but also that integrated view for people with complex and enduring mental illness is important in terms of trying to understand, are there clinicians that they've already got relationships with in the SA Health system? Are there, what is their underlying diagnosis? Have they tried to harm themselves in the past and they're threatening to harm themselves now? That sort of thing. We have invested heavily in a couple of new additional clinical psychiatrists in our region. We have also invested in a clinical psychologist as part of the flood response, and we've invested in a couple of consult liaison nurses in our emergency departments so that mental health services are available or support is available to clinicians in our emergency department. But that same level of support isn't available uniformly across the whole region, and it is how do you reach out and provide support to isolated, vulnerable people in small communities, some of whom might be choosing to live in small communities because they're trying to hide from the mainstream or escape the mainstream. And I think that's a real challenge, and that's where community networks are actually really important, like the Suicide Prevention Network and so on. Any other questions? And did that answer your question?
Yeah, I guess the clinical psychologists and psychiatrists, how do we go about making sure that their services are available over the whole LHN?
Yeah, so in terms of how we make their services available across the whole LHN, the main thing is having referral pathways. That's easy where there are GPs. It's harder where there aren't GPs. And I'm conscious of towns like Morgan and Blanchetown that don't have direct access to GPs, and where some of the service providers in the primary health sector have pulled out of, so a nurse practitioner has pulled out of providing a service in Morgan, for example. Certainly the GPs in Waikerie can make referrals to them. And there is this statewide ECLS, triage and liaison service available for people in crisis as well. And so it's about making sure that the right people have access to that. I think the other thing is, promoting community-led initiatives like mental health first aid training and so on, and encouraging as much of that stuff as possible. And do we have any questions? Any other questions about anything in the room or online? Odds are, if someone's got a question on the edge of their tongue, there are 3 other people who are thinking about it but even more nervous about asking it. Yeah, we'll just wait a second in case there's a little delay on someone posting, if they're madly typing it in. Okay, I will just encourage anyone, if they do have a question, just because the meeting's over doesn't mean you can no longer ask it. We have live streamed this on Facebook. You can post a question on the live stream, and whilst our staff do have to sleep at night, they will be able to answer it at some stage. And so I do encourage anyone that has got a question just to ask it, and we'll do our best to answer it. So thanks everyone. Have a good night.